There is a storm brewing in Nigeria's health sector as professionals in the sector exit Nigeria in droves to more developed countries. And this trend has been going on for years and has adversely affected healthcare services in the country. And now the situation is nudging towards an emergency. As of 2020, Nigeria had a doctor-patient ratio of 1 to 2,753, as against the World Health Organization's recommended minimum ratio of 1 doctor to 400 patients. Initially, it was reported that the health workers were in search of better working conditions, better pay and job security. But a new study by an agency said that some big private hospitals in Nigeria are also facing rejections despite offerings of a work setting that matches global standards, a pay level that doubles local average or is at par with some foreign offers. Now, these are some of the issues. Public health physician Tuyi Mebawondu is here with us to make sense of all of these. Doc, good morning. Good to see you.
Good morning. Great. Nice to see you, Mike.
Nice to see you, really.
Yes.
Now, sometimes we hear, in fact, we've been hearing this story of so many health, not just medical doctors, even nurses and other, health workers leaving the country. We may not understand how deep these things may be. Try to enlighten us, really, what the trends are and what the consequences of this could be before we go into some other variables of this issue.
Let us appreciate the fact that one of the key lessons of the COVID-19 pandemic bring to the fore the serious importance of health worker in global stability, economic prosperity, and peace of any country. Now, the weapon of the warfare of the future is not really tanks, bombs, and the number of military boots you have on the ground, but rather the strategic number of health workers domiciled within your country to respond to a pandemic that can disrupt your economy, that can disrupt your state, that can even lead to riots, overthrow of government, and all those stuff. And of course, the happenings around the world, even the developed world, will let credence to this assertion. So now, here we are in Nigeria. Consistently, we've been seeing the egress of medical professionals, not just doctors, nurses, pharmacists, key intelligent work in the health system, like laboratory people, everybody exiting the country for a better crime. In a way, the push factor has been accentuated in this country. The push factor has to do with actually, even the government themselves are not really helping anybody. Once they are sick, they run abroad. So they are actually demarketing their own health system. And if you look at it, funding is a problem. Environment is a problem. Nigeria seems to be like in a war situation where nobody seems to know what next. Because the first thing anybody wants to do is to actually say, am I safe? How do you explain we're having dearth of training of doctors perpetually on strike, and even not just health workers, they are perpetually on strike. At the level of universities, at the level of government, and where they're working in teaching hospitals, they are perpetually on strike. The primary healthcare system is barely 10%, starved, scattered all over the country, non-functional, no human resources. And then we need to respond to critical health challenges, either as a pandemic, endemic, or evolving disease. How do you respond if you don't have health workers? And it has been such a way that even the people that are supposed to know are telling you that, look, doctors can go and become tailor. You can go and plant yam or whatever. So, again, these are critical issues. It seems that there's no future for anybody aspiring to be a health worker in this country. And then the pull factor then now worked on that and take them, say, please come. I can make you a better doctor. You can achieve what you want to. You can become super specialist in an area. And then we'll ensure that you have good security. We'll take care of your family. And then now we've been folding our arms for years and watching all these things.
What will the consequence look like in the situation where, from the study, where the ratio of doctor to patient in Nigeria now is about 1 doctor to 2,700 thereabout, when we're supposed to have 1 doctor to about 400 people?
You see, what that simply, the consequence obviously is there, because now when you see, there are indicators. When you see some people who claim to be prophet are wrestling Satan, claiming to be curing people. When you see the preponderance of all sorts of mixture and concoction being hawked as a cure for all sorts of things, because people are not seeing help, you know, in their health institution, they have to actually look for alternatives. And these are indicators. And then what that means is that going to the future, it's going to be difficult to access critical health care in the country. It means that we have to be subjected to forces of nature in terms of getting treatment. And lo and behold, the country economy will suffer, our response to challenges will suffer, and so many things will also suffer in the regard. So it has both economic and social consequences for us. So it is important that, as it is, if we don't respond appropriately, what the outcome will affect us both socially, economically, and even health-wise.
All right. It's good to have, you know, to look deeply into some of these things and to see how scary it is, not necessarily to scare anyone, but to look critically at them and then see how we can begin to look for solution and so on. Now, you're watching TVC Breakfast. We're speaking with Dr. Tuyi Mebawondu here, talking about the issue of doctors, health workers leaving the country. Shortly after now, we'll be having an engagement with the candidate who just won the primary election in Ekiti State. We'll have that shortly. Now, let's talk about the issue of way forward for this. Okay. All right. I understand we have to go on a break first. Let's go on a break and then we'll be right back. Stay with us. You're watching TVC Breakfast. We were looking at health-related issues with Dr. Tuyi Mebawondu, and we have to round that up right now. Dr. Tuyi, thank you so much for coming on the program. I'm sorry that we couldn't wrap up all the issues because there was still the issue of solutions and way forward on this, but we'll find more time to talk about this.
Thank you so much. One of the key things that led to this delay was because of insane behavior of Lagos traffic management people.
Okay,
now,
yeah, because
just at the gate here, you know, they blocked me. You know, of course, the governor was passing. They said, okay, wait. They blocked me. After that, you know, when I was trying to come out to explain something to them, one of them said, oh, you are not wearing seat belts, and block me. Most of these should be corrective and not punitive. Okay. Even if you find that I'm not wearing seat belts, it should be corrective and not punitive.
It's okay.
Please, this is not the right way to run a mega city. Oh, please.
All right. Thank you very much for coming on the program.
Thank you.
Thank you.